My name is Ming Nguyen. I am the Public Health Program Manager for Madera County Department of Public Health. I manage the Communicable Disease Control Program as well as Epidemiology and Vital Statistics. I grew up in Vietnam and I came to the US when I was 8 or 9. I think this kind of all started when I took my first Public Health 101 class and just kind of seeing a lot of the health inequities that happen in the United States. I think that kind of drives you to feel motivated to kind of go out there and help others. So that's kind of where all the passion started. So as a public health program manager, a lot of the duties involves grant management, personnel management, and then sometimes you get to do the fun things like handling or monitoring infectious diseases, talking to partners and notifying the community about what might be at risk or what they need to look out for. The process of data collection is kind of extensive, and I think the more you work in the role, the more you learn. A lot of the time, it actually starts even before the planning process, right? You need to have great relationship with community partners, the community, so then you know how to be able to leverage and go out and collect data. And then understanding what the target reason for you to go out and collect data for, right? You don't just want to go out and collect data just so you can have the data. You obviously want to have a good objectives or goal of what you're going to use the data for. And then you start sitting down and you start planning, which involves more than just even the epidemiology program. It involves communication team because obviously they have to do outreach and promotion. Sometimes we utilize a lot of our community partners, like other governmental agencies or community-based organizations to help us, not just like go out and collect the data, but help us like narrow down what actually is needed for the data collection. Are we asking the right questions? Are we approaching the right population for this? And especially when you're doing data collection, it's a very extensive process, so you want to make sure you do it right the first time. Even before going out and collecting the primary data, you want to make sure you do really thorough research on what the secondary data are available and leverage that before you design your own survey tools or data collection tools and going out to the community. So it involves a lot of partnership with the community, but once we collect the data, we understand what the issue might be, we're going out, presenting it to the community. The data drives initiatives, and the initiative can't really happen unless you have partners in the community. I think when you work for the government, you're kind of a civil servant. So being able to go out there and serve the community is actually really rewarding. You have a sense of seeing the bigger picture, and sometimes people don't see that. So leveraging that and being able to go out with the resources that you're provided just to help the community. And when you see the health improve and things you do actually work, it actually feels very rewarding. For a student who wants to pursue a career in my role, they definitely should try to seek out opportunity to volunteer interns at local health department just to see. Public health is very vast. There's so many different programs. And depending on what you like doing, you can probably end up in different roles. Health department are really open to students just reaching out and asking to volunteers or shadow or even getting informational interviews with program manager position like mine, just to at least kind of get a sense of what they do and see if they're even interested in that. I think the role that the local health department play is actually very important. I feel like local government actually is probably one of the most critical level of government, just because that's the level where you're going out in the community, you're seeing the real problem in the community. So you have the most opportunity to be able to address some of the problem in the community. If I can go back in time, I probably would tell my 21-year-old self that don't take school as something that you have to do. Take it as an opportunity for you to learn things that you might think is useful.